An animation begins, showing a cross-section of a healthy, dense bone matrix. As the animation progresses, the internal structure of the bone becomes more porous and fragile, visually representing the decrease in bone density over time. Narrator VO. Osteoporosis is often called a silent disease because it can progress without any symptoms until a bone breaks. This condition weakens bones, making them fragile and more likely to fracture. Early detection is your best defense, allowing you to take proactive steps to protect your bone health and maintain your quality of life. Recognizing the subtle early signs is crucial, as it can prompt you to seek medical advice before a serious injury occurs. Let's explore some of the key indicators that might signal the onset of this condition. Scene 2. Visual. An elderly white woman with gray hair and a simple cardigan stands against a height chart on a wall. Her expression is one of concern as she looks at the measurement, realizing she's shorter than she used to be. Narrator VO. One of the most common yet often overlooked signs of osteoporosis is a gradual loss of height. As the vertebrae in your spine weaken, they can start to compress, leading to a noticeable reduction in your overall stature. Losing an inch or more in height can be a significant red flag that your bone density is decreasing. This change might be subtle at first, but it's a clear signal that the structural integrity of your spine is being compromised. Scene 3. Visual. A middle-aged man with short brown hair is casually gardening in his backyard. He bends down to pull a weed and suddenly winces, clutching his lower back in sharp, unexpected pain. Narrator VO. Sudden, severe back pain without any obvious injury can be another indicator. This discomfort is often caused by a vertebral fracture, which can happen from something as simple as bending over, lifting a light object, or even coughing. Because the bones in the spine have become brittle, they can no longer withstand the minor stresses of everyday activities, leading to painful compression fractures that can significantly impact your mobility. Scene 4. Visual. A simple silhouette of a person is shown against a plain background. Over a few seconds, the silhouette's posture changes, gradually developing a distinct forward curve in the upper back, resulting in a stooped or hunched appearance. Narrator VO. A change in your posture, such as developing a stoop or a condition known as kyphosis, is another telltale sign. This forward curvature of the spine happens as weakened vertebrae in your upper back collapse or compress. This doesn't just affect your appearance, it can also cause chronic back and neck pain, and may even affect your breathing by reducing the space in your chest cavity for your lungs to expand. Scene 5. Visual. A close-up shot of a person's hand attempting to twist open a glass jar. The hand trembles slightly, unable to get a firm grip, highlighting a clear struggle and weakness. Narrator VO. Studies have linked overall bone density with grip strength. If you find yourself struggling with tasks that were once easy, like opening jars or holding objects firmly, it could be a sign of weakening bones throughout your body. While decreased grip strength can be related to other factors, its connection to low bone mineral density makes it an important piece of the puzzle when assessing your overall risk for osteoporosis. Scene 6. Visual. A tight close-up on a person's mouth, focusing on their teeth and gums. The gums appear to be receding. An animated overlay appears, showing the underlying jawbone and illustrating how its loss of density can contribute to this issue. Narrator VO. Your jawbone is also susceptible to the effects of osteoporosis. Bone loss in the jaw can cause your gums to recede and may even lead to tooth loss. If your dentist notices significant changes in your oral health, such as receding gums or loose teeth, it might be an indication of systemic bone loss that extends beyond your mouth. It serves as another subtle clue that your skeletal system may be weakening. Scene 7. Visual. A dynamic split screen or collage appears, quickly showing all the signs just discussed. The height chart, the man with back pain, the stooped silhouette, the hand struggling with the jar, and the close-up of receding gums. The scene then transitions to a final hopeful shot. The elderly woman is now sitting in a bright, modern doctor's office, talking consultatively with a friendly and attentive doctor. The atmosphere is positive and reassuring. Narrator VO. These signs, loss of height, back pain, poor posture, weak grip, and receding gums, are your body's early warnings. If you notice any of them, don't ignore them. Schedule a conversation with your doctor. Early diagnosis and a proactive management plan can help you strengthen your bones, prevent fractures, and continue to live a full and active life. Scene end.